Hello. Hi everyone. Thanks for tuning in. We're just coming back from a little break. We are still on our second case of the day with Dr. J and Dr. Phillips. Hope everyone's doing a great. We are still on that super mommy makeover without a BBL. So what all that includes is a breast augmentation, so implants and then a lift. We're also doing a tummy tuck, lipo 360 on our patient, and also lipo to our patient's chin. So earlier we were live for a few minutes. We took a quick break to flip our patient over, and now we are now our patient is on their backside and we are doing their breast. So we are still on our second case of the day. If you guys have any questions, I would be happy to answer any that you may have. If you want to just comment those down below. We're also live over here with Dr. Phillips at Dr. Bam on TikTok. You guys can share this live if you know somebody who's interested or has any questions themselves. You can send this to them or comment any questions you think they might be interested in asking. So I'll be looking over here at Dr. Bam and then over here at Dr. Boom Boom Pow. So in case you guys see me looking at different places, we are also live on our YouTube if you guys want to join us over there as well. You can find us at Dr. Jeneby Plastic Surgery over there on our YouTube. What makes it different from TikTok and Instagram is we actually show the patient themselves. We show the procedure, we show our surgeons, we show the patient. So it is a lot more to see. It's a lot more graphic. If that's something that interests you, you can join us over there. A lot of our patients, loved ones and family and guardians, people that, even their friends, will like to join us over there on our YouTube. It's kind of like a security thing. It's like making sure that they, everything's going fine. Of course, we get consents for that. So our guests are also welcome to see that. Thanks for liking the live. We appreciate it. And again, I'm here to answer any questions you may have. So please do feel free to comment those down below on our live or private message us. Or you guys can fill out that form on both Dr. Bam's and on Dr. Boom Boom Pow's TikTok. You guys can fill that out. Once you fill that out, it's going to be submitted to our team, and then someone from our team will look at your information and contact you. And that's just going to help us gather information so that when someone does reach out to you, they are able to answer any questions you may have about some of the services that we offer here. Any of the procedures that you're already interested in getting done, we can help figure out financing, scheduling, consultations, all of it. And it only takes about a minute to fill out. So again, that form right there, you can fill that out. It's going to get you connected to someone in our team, or you can find it at the Get a Quote button on our page. Fill it out, it takes about a minute. And again, we are live on our YouTube. Again, we are on our second case of the day. We are on our, good. What's that? Yeah. So we are on our second case of the day still. Earlier this morning, we got started with some some lipo 360 on our patient. So our patient was laying on their stomach, so face down on the operating table. And we had Dr. J, we had Dr. Phillips just extracting some of that fat. So some lipo, doing lipo on her back and on the sides. Extracted that fat, and we went ahead and took a little bit of a break. And since our patient isn't doing a BBL, we just took all that fat, and then we took a break. We flipped our patient over, so onto her back side. And now we are going to finish up the rest of the procedures that she's having done today. So she's also getting a breast lift, a breast augmentation, and a tummy tuck. So if you guys have any questions about that, go ahead and comment down below. We can ask our surgeons, we can ask our doctors, or I can answer it for y'all here today. Again, we are on our second case. Our patient here is doing a breast augmentation, breast lift, tummy tuck, and lipo 360. So a super mommy makeover without the BBL. Thank you guys for tuning in. We appreciate y'all. This may be our last live of the day, but we will be live later this week, so definitely tune in. We have some exciting cases. Earlier this morning, we had our first patient come in. We got started at around 8 a.m. and our patient got lipo 360 with a tummy tuck. It was a pretty quick procedure. We do see those quite frequently. Again, we are also live on our YouTube. If you guys would like to see the surgery happening, if you would like to see our surgeons operating, so Dr. Jeneby and Dr. Phillips. I think I missed a comment. Rhode Island family, 18 days until my pinnacle-nectomy. Awesome. So excited. Are you having that operation done here with us or another surgeon? Okay. Hi, thank you for tuning in. We were live earlier this morning with our patient here. We showcased, or not showcased, yeah, showcase. We showcased some of our lipo extraction. So just removing some of the fat on our patient. So on her backside and then on her sides. And we are finishing up our second case of the day. So our patient is also getting lipo done around her abdomen, around the front, so on her sides as well. And she is getting a breast lift with implants. And she is also getting lipo on her chin. So this is a super mommy makeover without the BBL. Usually we will see, whenever there's lipo in a super mommy makeover, we will usually see a BBL because that's how we do our BBLs here. We'll take fat that we extract from our patient's body and then add it to their butt. And so, but our patient today, she doesn't want to add anything to her butt, which is totally fine. We do that here, but sometimes it's like, well, once we remove that fat, it just kind of makes more sense to go in and just take that fat and add it to the butt. But of course, like if our patient doesn't want to do that, then we're not going to do that. She's happy with what she has, which is amazing. But that is why it's just a super mommy makeover without the BBL. But thank you guys for tuning in and joining us. Again, we are doing a breast augmentation, breast lift, tummy tuck, lipo 360. So again, a super mommy makeover without a BBL. So feel free to comment down those questions. If you guys are ready to take the next steps, you guys can fill out that form that I have pinned here on our page over here, or it should be on the bottom. You can fill it out. Once it's submitted and filled out correctly, it's going to be sent over to our team. They're going to look it over and reach out to you. And so you can ask any questions from there on out. They will provide you with more information about financing, about accommodation, about what pre-op, post-op is going to look like. So take advantage of that. It only takes about a minute to fill it out. So if that's something that interests you, definitely take advantage of that. And we are live. If any of y'all from Dr. Bam's TikTok are interested in checking out who else we are operating with today, you can join us at Dr. Boom Boom Pow. Check out our other surgeon. So Dr. Phillips and Dr. Bam are operating together on our patients. If you want to just check him out, you can see some of the content that he posts over there. Show him some love. And if you know of somebody who's interested in any of the procedures that we offer here, or is ready to take the next steps, and scheduling their consultation and getting ready for surgery, you guys can send this live to them. We'd be happy to have them. We can answer any questions that they may have. And this may or may not be our last live of the day with Dr. J and Dr. Phillips. Just an FYI, we may have one more. We may have one more case that we will go live with. We're just waiting to see with our patient whether or not. But if you guys give us a follow, you will be notified every time that we do go live. So Dr. J and Dr. Phillips, they have just added the implants in our patient's breast. And so now they're just looking to make sure that they are symmetrical before they move on. So they just sat our patient up just to make sure like they look beautiful and are everything that our patient was expecting. And we have Dr. Phillips there. He was just doing some lipo on our patient's abdomen. It's all right. Things happen. We just dropped a little tool. Hello. Thank you for joining us here on our live. From Dr. J to Dr. Bam. Thank you guys for tuning in. Again, our second case of the day. We are on our second half of our second case. So any questions that you may have, just feel free to comment those down below. I'd be more than happy to answer those for you. Or we do have Dr. J and Dr. Phillips here, more experienced than I am. I've seen a lot more crazy things than I have. So we can have one of them answer any crazy questions you may have. For those of you who are on our YouTube, thanks for joining us over there as well. And again, if any of y'all are interested, it's going to be at Dr. Jeneby Plastic Surgery. You'll see some other surgeons' names there. We go live on that YouTube collectively for our other surgeons. So you will see Dr. Bam, Dr. Latin Heat. And if you see those names listed in that handle, you found the right account. Hello, hello. Hello, hello. Thank you for joining us. We are on our second half of our second case. For those of you just getting on, earlier we did part of the lipo portion of our patient's procedure today. So we had her on her back side, on her stomach. We took some lipo, we did some lipo on the sides and around her back. You know, those stubborn areas where we tend to see fat just not looking great, poking out through our bra, and is just more visible when we're wearing something tight, just like kind of folds over whatever garment we're wearing. So that's the lipo that we did on her backside and on her sides. And now Dr. J and Dr. Phillips have flipped our patient over, and she is laying on her back now. And we just finished with the implants. We are going to do the lift here shortly. And Dr. J is going to get started on that tummy tuck. I'm going to see if I can kind of switch sides and come over here. Okay, that's a little bit better. Ow. But again, thank you guys for joining us and staying tuned to what we have going on here. If you guys are interested in seeing more of our lives and tuning in more on our other platforms, you guys can give us a follow and you'll be notified every time that we go live. Thank you for the like, Miss Sandra Martinez. We appreciate it. And again, maybe you're ready to take the next steps into booking your surgery. We do have a form pinned here on the screen on the bottom, or it's going to appear in the top on both Dr. Bam's and Dr. Boom Boom Pow's TikTok. You guys can hit that form, fill it out. It's just going to ask you for some of your information. It is also going to be that get a quote button. Once you submit it, somebody from our team will reach out to you. And you guys can ask them any questions if interested in any of the procedures here. CC asks, where is he based out of? Yeah, great question. So Dr. J, Dr. Boom Boom Pow, he operates here in San Antonio, Texas. We operate here at Maximus Surgery Center in Chrysalis. So you can look those up, or if you hit the link tree in our bio, it's going to take you to a lot of different websites. It's going to take you to our website, and you can find more information about where we operate and where that's located. It's located in Stone Oak, so that's going to be northern San Antonio. And same with Dr. Phillips, so at Dr. Bam. Dr. Phillips operates here in San Antonio, Texas at Maximus Surgery Center and Chrysalis. So for those of you who are joining us on Dr. Bam's TikTok, he is also located here in San Antonio. Thank you, Sandra, for liking the live. We appreciate it. And again, I'm just here to answer any questions that you may have about our procedures, the kinds of services that we offer here, and how I can get you connected with someone from our team to schedule that consultation, to schedule that surgery, you name it. So do not hesitate. And again, for those of you who are just getting on, we are live on our YouTube at Dr. Jeneby Plastic Surgery. Over there, you will see what I'm seeing. So the operation itself, you'll see our surgeons. You'll see some of our other team over there as well. You'll see what the operation looks like. So right now, if you are on our YouTube, you can see here, we have Dr. Phillips, and we have...
It's gonna be 100.
If you are there on our YouTube, you can see that we have Dr. J and we have Dr. Phillips finishing up the breast portion, and we have Dr. J kind of removing our patient's fat from her abdomen and rolling back. We do have a little surgical table kind of blocking that, but here in a moment you'll be able to see what I'm talking about. It's just kind of folding it back. So we made an incision on our patient's lower abdomen from hip to hip about, and from that incision he made another going up to our patient's belly button. That's how most tummy tucks work. And what happens from there is he's able to fold back that skin, fold back that fat, and they have it kind of mapped out with markings on our patient's body where they're going to go in and remove the excess skin and a little bit of the excess fat. And then from those incisions, they cut the extra and then they cinch it back. They kind of stretch the remaining skin and back to where they made that first incision. And obviously it just kind of helps give that tucked look, tighter look, makes it look really flat. So, you know, when you put on pants or like your undergarments and things like that, and you see the fat folding over, it's not going to look like that anymore because we removed that extra part and just cinched it where it does look more flat and obviously tucked away. That's why it's called the tummy tuck. No, you're good. Again, if you guys have any questions about that, and for those of you on our TikTok, on both Dr. Bams and Dr. Boom Boom Pals, if you guys have any questions, maybe you don't want to join us over there on YouTube, feel free to comment those down below. And what's happening right now in the OR. But feel free to join us over there on YouTube as well at Dr. Jeneby Plastic Surgery. Again, you'll be able to see everything I'm seeing. So you'll be able to see the surgery happening. So consider that. And this may be our last live of the day. But if you give us a follow on all of our platforms, you will get notified the next time we go live. We are not sure. We're waiting on our last patient to see what they would like to do. If they would like to go live with us or not. It's definitely not essential that they do go live or we don't make them go live. It's all consent based. Brenda Campbell there on our YouTube says, hi there, work is incredible. Awesome, thanks for joining us over there. What are you thinking so far? Again, for those of you just joining us, we are doing a super mommy makeover without the BBL, so without a butt lift. So we're not touching the butt really at all. So what we are doing is we are doing a breast lift. So lifting our patient's breasts, we are adding implants, we are doing a tummy tuck, and we also are doing lipo 360. Usually we will see a butt lift if we are doing lipo 360, because once we extract all of that fat, it just makes sense since that's how we do a BBL. We need fat, and so if we already go in and extract all that fat, usually we'll see people adding on a butt lift. But our patient here today did not want that. She does not want to add anything to her butt. She is satisfied. She said maybe later on in the future. So we will see about that and how she heals and what her body is looking like later down the road. But of course, it's not essential. We'll pair a lot of different surgeries together, so it's not cookie cutter, one fits all. It's very personal to our patient's desires. So definitely consider that. And again, maybe you're ready to take the next steps, both here on Dr. Bam and on Dr. Geneby's TikTok. You guys will see a form pin. You can fill that out. It takes a minute. Once it's submitted, somebody from our team will reach out to you, and you guys will have a time to answer, or ask any questions you may have about any of the services that we offer, what surgeon you'd be interested in going with, and what the next few steps are going to look like. Yeah, you're good. It's Amy says, oh, excuse me. It's Amy, like the live. We appreciate it. Thank you for engaging with us and tuning in. Feel free to comment any questions. Be happy to answer those for you, or have one of the surgeons answer your question. Again, we are on the second half of our second case today here at Maximus Surgery Center with Dr. J and Dr. Phillips. And so for the first half, we did part of the lipo 360 on our patient. So we started off with her on her stomach. We did some lipo on the back, on her sides. We took a break.
We're missing the cord that goes from the boat to the tower.
We took a little break, and now we are back and finishing up the breast augmentation, the breast lift, and the tummy tuck.
Or you can just plug these top cords into the Nubian.
So feel free to comment any of those questions. This may again be our last live of the day, so definitely take advantage of the time that you have here. Thanks for liking the live, Miss Amy. We appreciate you, and thank you for tuning in. Again, I'm here to answer any questions you may have. We are located here in San Antonio, Texas, in the Stone Oak area, so that's going to be northern San Antonio. For those of you who are joining us out of the city or even out of state, we do offer a lot of accommodations. We offer a lot of financing options. So if that's something you're considering, coming here and joining us and having us operate and perform your surgery, definitely consider filling out that form. And then somebody from our team will give you all of the details necessary to set that up. It happens all the time. We see it all the time. So do not hesitate if you're considering. We'll be live here for a few more minutes. I'll give you guys a few more minutes to ask any questions. Again, if y'all are interested in taking the next steps, booking your consultation, we do physical, so in person, and we do virtual. You guys can fill out that form that I have pinned on both Dr. Bam's TikTok. You'll see it down here, or you'll see it up here. Also on Dr. Boom Boom Kyle's TikTok, you'll see that form as well. Or you'll see it at the Get a Quote button in our bio. Click that, fill it out. Once you submit it, somebody from our team will reach out to you. You'll be able to ask any questions when they do. They're just going to entail further about what you're considering, how they would set that up, give you all the details about the pre-op, post-op, financing, accommodation, all of those details. So definitely take advantage of that. It takes about 1 minute. It's super quick, super seamless. And we will be live later this week, if not later today. So if you'd like to give us a follow, you'll be notified anytime that we go live. Again, thank you, Miss Amy, for the like. We appreciate that. Again, maybe you didn't ask any questions here. You guys can reach out to us privately, DM us. And we are going to take a little break. You may see us later today. We've been live for about 30 minutes. We're going to take a little bit of a break. Give us a follow if you'd like to tune in to the next time that we go live. You can ask more questions then. Again, thank y'all for joining us. For those of you who did have questions, you can fill out that form that I have pinned. It takes 1 minute. Someone will reach out to you. All right, you guys, thank you for joining in for our second case of the day with Dr. Jeneby and Dr. Bam. We appreciate it. Thank you for engaging with us, and we will see y'all next time.